Hey there. Ready to take a deep dive into menopause and hormone therapy? You sent over some interesting excerpts from Up to Date,
Absolutely.
which is fantastic because there's
Like,
so much info out there.
right.
It can get really overwhelming.
It can.
We're going to cut through the noise and pull out the insights that are most relevant for you.
Absolutely. And it's especially important to have reliable information when it comes to a topic like hormone therapy,
Mm-hmm.
which has had its share of controversy over the years.
Yeah?
Up to Date is great for that.
Okay, so let's just say someone is listening and thinking, okay, menopause, hormone therapy, I know the basics. Where does Up to Date go beyond those basics?
One thing that stood out to me is their emphasis on personalized treatment,
Yeah.
even when it comes to something as seemingly straightforward as estrogen.
Oh, interesting.
Yeah,
Saw in here that they have a preference for a specific type of estrogen.
exactly.
What's the deal with that?
So while Up to Date says different types of estrogen can be effective for managing symptoms like hot flashes, they highlight 17 beta estradiol. Okay.
They point out that this type is bioidentical, meaning it's structurally identical to the estrogen your body naturally produces.
Okay.
It's like the difference between, say, a generic medication and a name brand.
Mm.
They both have the same active ingredient, but your body might respond a little bit differently.
That actually makes a lot of sense.
Yeah.
And it speaks to that whole personalized medicine thing.
Right.
What else did Up to Date highlight about making hormone therapy more tailored to the individual?
Well, they really emphasize how estrogen can be delivered.
Okay.
It's not just about popping a pill anymore.
Right.
They point out that for certain women, transdermal estrogen, meaning through the skin with a patch or cream,
Okay.
might be a better option.
Is that about minimizing side effects or is there something else going on there?
It's multifaceted.
Okay.
For some women, transdermal estrogen might have a better side effect profile.
Okay.
For example, it can potentially lower the risk of blood clots compared to oral estrogen.
It can also be more stable in terms of hormone levels in the bloodstream,
Okay,
which some women find helpful.
that's fascinating.
Yeah,
It's like they're saying there's no one size fits all approach.
exactly.
Really have to consider all the angles.
Exactly. And this emphasis on personalization goes beyond just the type or delivery method of estrogen.
Okay.
Up to Date is very clear that dosing is not something to gloss over.
Yeah, they were pretty adamant about that.
Yeah.
It wasn't just a small point, it seemed like a core message.
Yeah.
What did they say specifically?
They stress the importance of starting low and slowly increasing the dose,
Yeah.
which is what's known as titrating.
Hmm.
This is a shift from how hormone therapy was often prescribed in the past,
Okay.
and it really highlights the need for ongoing communication with your doctor.
It made sense.
Right.
Everyone's body is different, and what works for one person might be too much or too little for another.
Exactly.
It seems like they're really advocating for women to be active participants in their own health care.
Absolutely. And that ties into another important point Up to Date makes.
Okay.
They really challenge the notion that hormone therapy decisions should be based solely on age.
Because for so long it was all about, okay, you've hit menopause, here's the standard protocol.
Right.
But Up to Date is saying, hold on, not so fast.
Exactly. They emphasize that it's crucial to consider your specific symptoms, their severity,
Okay.
and your individual risk factors for things like heart disease, stroke, blood clots, and breast cancer,
Wow.
among others.
So it's about weighing the potential benefits and risks in the context of your own health history.
Precisely. And this is where those open conversations with your doctor are essential. They
Mm.
can help you navigate those nuances and make the most informed decision.
It's about having all the information, right?
Yes,
And feeling empowered to advocate for what you need.
exactly.
Speaking of information, Up to Date didn't shy away from some of the more controversial or trendy topics surrounding hormone therapy,
Right.
like this whole bioidentical hormones thing.
Yes. And their stance on that is very interesting,
Okay.
especially because there's so much buzz about bioidentical hormones in the media and online.
Right. It seems like everyone's claiming they're the natural solution.
Mm-hmm.
What does Up to Date have to say about that?
Well, they acknowledge that bioidentical sounds appealing
Yeah.
because these hormones are often marketed as being identical to what your body produces.
Right.
And structurally, that's true.
Okay.
These are compounded hormones, meaning they're custom made by a pharmacist based on a doctor's prescription.
Okay.
But here's the catch.
This is where it gets really interesting. Tell me more.
Up to Date advises against using compounded bioidentical hormones.
Really?
They highlight a key concern, which is the lack of regulation and research.
Mm-hmm.
Unlike commercially available hormone therapy, which undergoes rigorous testing and standardization.
Right.
Compounded hormones don't have that same level of oversight.
So you don't necessarily know what you're getting,
Right.
and there's not as much research to back up their safety or effectiveness.
Exactly. Up to date emphasizes that this lack of regulation raises concerns about the purity, potency, and potential for contamination.
Oh,
And while they acknowledge some women might find them helpful,
okay.
the lack of scientific evidence to support their use is a major red flag.
So buyer beware.
Yeah,
Just because something is marketed as natural doesn't necessarily make it safer or more effective.
right.
It seems like sticking with FDA-approved hormone therapy might be the way to go.
That seems to be up to date stance
Okay.
based on the research they cite.
Okay, so we've talked about estrogen, but what about testosterone?
Right,
It's not just for men, right?
right.
But I get the sense that Up to Date isn't entirely convinced about its use in menopause.
You're picking up on something important.
Okay.
There's a lot of talk about testosterone and its potential benefits for women experiencing low libido or low energy during menopause.
Mm-hmm.
However, Up to Date doesn't recommend routine testosterone therapy for most women.
Interesting. So it's not a given,
Right.
even if you're feeling those symptoms.
Right. Up to Date states that while some women might see improvements in certain areas,
Okay.
the research is still inconclusive.
Mm.
They also point out that the potential risks and long-term effects of testosterone therapy in women aren't fully understood.
So it's about having that conversation with your doctor,
Exactly.
weighing the limited evidence against the potential risks,
Right.
and making an informed decision.
Exactly. And it's worth noting that Up to Date does mention non-hormonal options for managing menopause symptoms.
Right. They touch on things like antidepressants and other medications that can help with certain symptoms, but it sounds like that's a whole other deep dive.
It is. Up to Date has separate articles dedicated to those non-hormonal options. So if someone is listening, wants to explore those avenues, it's worth checking those out.
Good to know. Okay, so let's say someone decides hormone therapy is right for them.
Right.
We've talked about estrogen, but there's usually another piece of the puzzle, right? Progestin.
You got it. And Up to Date keeps it pretty straightforward. Progestin is essential for women who still have a uterus.
Okay, so why is that? What does progestin actually do?
Basically, it acts as a counterbalance to estrogen in the uterus.
Okay.
When you're taking estrogen therapy, it can stimulate the lining of the uterus,
Okay.
potentially leading to a condition called endometrial hyperplasia.
That's not good.
Not good at all.
Okay.
It's basically an overgrowth of the uterine lining, which
Okay.
can increase the risk of uterine cancer.
Got it.
Progestin helps to keep things in check and reduces that risk significantly.
So if you have a uterus,
Right?
progestin is non-negotiable when you're on estrogen therapy.
Correct.
Up to Date even had a preference when it comes to the type of progestin, right?
They did. They highlighted micronized progesterone,
Okay.
which is interesting because it aligns with this trend toward more body identical approaches in medicine.
Okay.
Micronized progesterone is chemically identical to the progesterone naturally produced by the body.
So similar to the 17-beta estradiol we talked about earlier,
Exactly.
it's all about mimicking what your body naturally does, but in a more controlled way.
Exactly.
But it's not just about the type of progestin, is it?
Right.
There are different ways to take it, too.
You're right. Up to Date discusses two main approaches, cyclic and continuous.
Okay, break those down for me.
Okay.
What's the difference? And more importantly, what does it mean for someone's actual life?
Great question. Cyclic progestin is typically taken for about 12 to 14 days each month.
Okay.
It mimics the way progesterone naturally rises and falls during your menstrual cycle.
Okay.
With this approach, most women will still experience some bleeding,
Okay.
similar to a period.
Makes sense. So it's more like what their body was used to before menopause.
Exactly.
What about continuous?
Continuous progestin, as the name suggests, is taken every day without a break.
Okay.
This usually leads to no bleeding at all after an initial adjustment period.
Wow. That's a game changer for some women, I'm sure.
Yeah.
No more periods.
Right.
But I imagine choosing between cyclic and continuous isn't just about the bleeding, right?
Definitely not. Up to Date doesn't explicitly lay out the pros and cons of each approach,
Okay.
but reading between the lines, you can see how individual preferences and lifestyle would factor in.
Okay, so for example, someone who is really bothered by irregular bleeding or heavy periods might prefer continuous progestin to just be done with it.
Exactly. On the other hand, someone who finds comfort in having a predictable, albeit light, monthly bleed might prefer the cyclic approach.
It's all about what works best for you, which seems to be a recurring theme with all of this.
Absolutely. And this emphasis on personalized care, taking into account your individual needs and preferences, is something Up to Date consistently emphasizes throughout these excerpts.
It's really refreshing, actually. It feels like a more collaborative approach to managing menopause,
Yeah,
rather than just being handed a prescription and told this is what you do.
I agree.
It's about empowering women to have more agency in their health.
Right.
Speaking of empowerment, Up to Date dives into some important nuances about hormone therapy that I think a lot of people might not be aware of, like how it relates to certain health conditions.
You're right. They touch on some sensitive but crucial topics like hormone therapy for women who've had breast cancer or who experience migraines,
Okay.
and their guidance is really insightful.
Okay, let's talk about breast cancer first.
Sure.
It's a big one, and I know there's often a lot of fear and confusion surrounding hormones after a breast cancer diagnosis.
Absolutely, and Up to Date addresses this head on.
Yeah.
They acknowledge that some women experience early menopause due to chemotherapy or have lingering symptoms related to tamoxifen,
Right.
which is a common breast cancer treatment.
Yeah.
But despite these challenges, their stance is clear. They advise against hormone therapy for anyone with a history of breast cancer.
Wow, even if their symptoms are really disruptive.
That's right.
Wow.
They cite concerns about the potential for hormone therapy, particularly estrogen, to increase the risk of breast cancer recurrence.
Okay.
They do mention that the research has been somewhat inconsistent in the past,
Okay.
but it seems like they err on the side of caution here.
Which makes sense, given the stakes. It's definitely not a decision to take lightly,
Right.
and it highlights the importance of open communication between oncologists and other healthcare providers.
Precisely. It's about coordinating care and making sure everyone is on the same page when it comes to managing both the cancer and the menopause symptoms.
Now, migraines are another area where hormone therapy can be tricky.
Right.
What did Up to Date have to say about that?
This is where it gets really interesting.
Okay.
You might assume that hormone therapy is off limits for women who experience migraines, especially those with aura,
Yeah.
but that's not necessarily the case according to Up to Date.
Really? I wouldn't have guessed that.
Yeah,
So it's not an automatic no.
not at all. In fact, for some women, hormone therapy can be helpful for managing migraines,
Interesting.
especially if their headaches are triggered by fluctuations in estrogen levels.
So it's almost like using hormone therapy to smooth out those hormonal peaks and valleys
Exactly.
that can trigger migraines.
Exactly. They do recommend a continuous transdermal estrogen regimen in these cases
Yeah, okay.
to avoid the sudden drop in estrogen that can occur with cyclic therapy,
Got
which
it.
can trigger headaches.
That's amazing. It really speaks to the complexity of these issues
Right.
and how you can't just make assumptions based on one symptom or condition.
I completely agree.
Yeah.
It's all about that individualized approach, considering the whole picture and working closely with your doctor to find the best solution.
It's incredible how hormone therapy can be so beneficial for some women with migraines. Yet for others, like those with a history of breast cancer, it's strongly advised against.
It really highlights the need for personalized medicine, doesn't it? Decisions about hormone therapy can't be made in a vacuum.
Absolutely.
Hmm.
And speaking of personalized approaches, Up to Date brought up another group of women who often need a different game plan when it comes to menopause. Women with primary ovarian insufficiency.
Right. This is when menopause happens prematurely, typically before the age of 40.
Okay.
It's not as common, but it's incredibly important to address.
Because for them, it's not just about managing symptoms, it's long-term health too.
Yeah, exactly. Up to Date makes a really crucial point about this
Right.
because these women experience estrogen decline much earlier in life.
Right.
They're at a higher risk for certain conditions down the road.
Like what kinds of conditions?
Well, because estrogen plays a role in bone health.
Okay.
Early menopause can significantly increase the risk of osteoporosis and fractures.
Okay.
Heart health is another concern,
Hmm.
as estrogen offers some protection against heart disease.
So it's about more than just hot flashes and night sweats for these women.
Right.
How does Up to Date recommend managing hormone therapy in these cases?
They suggest continuing hormone therapy until around the average age of menopause,
Okay.
which is 50 to 51.
Okay.
It's about bridging that hormone gap and providing protection against those long-term health risks.
So for some women, it's about taking a long-term view of hormone therapy,
Right.
not just thinking about immediate symptom relief.
Absolutely. It's about taking those individual factors into account like we've been talking about.
It's been fascinating to see all these different angles that Up to Date has brought up. The nuances, the exceptions, the personalized approaches.
It really makes you realize that menopause management isn't a one-size-fits-all approach.
Right.
It's about gathering the information, talking to your doctor, and figuring out what works best for you.
Well said. And you've given us a lot to think about today.
You're welcome.
It feels like we've only just scratched the surface, though.
Right.
There's so much more to learn about menopause and all the options out there.
There definitely is. But I think the biggest takeaway from Up to Date is the importance of being proactive, advocating for your health, and finding a healthcare provider who listens and takes a personalized approach.
Couldn't agree more. It's about having those open conversations, asking questions, and feeling empowered to make informed decisions about your body and your health.
Exactly. And remember, this deep dive was just the beginning. Armed with these insights from Up to Date, you're now better equipped to navigate those conversations and advocate for the best possible care.
And one final thought for our listeners to ponder as they continue their menopause journey.
Okay.
Even Up to Date acknowledges that there's still so much we don't know about this phase of life. But that shouldn't be discouraging.
Right.
It's actually an invitation to stay curious, keep asking questions, and be an active participant in your own health.
Beautifully said. Knowledge is power, and the more we learn, the better equipped we are to make informed choices for our well-being.